The World Health Organization came into existence in 1948, but the operations in Kenya did not start until 1963. WHO predominantly works upstream with policy and decision makers at headquarters and provincial level, mainly supporting policy development in different aspects of health interventions. The current WHO representative, Dr. Abdullahi Jack, provides leadership on matters critical to health. WHO supports the government of Kenya through the Ministries of Health. The technical cooperation between the country and the global body addresses the National Health Sector Strategic Plan and the Millennium Development Goals, MDGs. Communicable disease prevention and control remains one of the critical areas of WHO support. This is implemented through the strengthening of routine immunization and campaigns to avert possible vaccine-preventable disease outbreaks such as polio and measles. Like many other African countries, Kenya has a heavy burden of HIV/AIDS and TB. However, effective government and partner programs which amalgamate the control of the two infections has led to a reduction in HIV/AIDS and TB cases.
Kenya uses the WHO strategy, and WHO has set targets for countries, so that once we reach those targets, we know if we sustain it, then we will have an impact to tip down the graph that is going up.
Like in TB and other programs, WHO advocates for strong partnerships in malaria control. A clear pointer to this was during the commemoration of the 3rd World Malaria Day 2010 in Lugali district of Western Kenya, where all the key stakeholders witnessed the official launch of the Kenya National Malaria Policy document by the Minister for Public Health and Sanitation, Honorable Beth Mugo.
Malaria is still a big challenge. It is still a health problem, but there are gains that have been made in the control of malaria, in the reduction of illness and death, and that we need to continue building up on these gains.
Non-communicable conditions which include cancers, diabetes, injuries and mental health are perceived to be on the increase in Kenya. WHO has been at the forefront in mobilizing support for programs to address the incidence of these conditions. As an example, the World Mental Health Day, which is commemorated globally on 10th of October, is used to create awareness on mental health. Reproductive, maternal, child and adolescent health are seen as critical to the realization of Millennium Development Goals 4 and 5. WHO and partners support planned activities to further this goal.
I must say that WHO has really played a big role in the introduction of IMCI into the country and also in building capacity.
WHO also collaborates closely with partners to respond to emergencies and disease outbreaks. Some of the interventions are evident in areas like the northeastern part of Kenya, which has time and again experienced drought among other hardships. Kenya is among the signatories of the WHO Framework Convention on Tobacco Control, FCTC. The global organization supports continued efforts to enforce the Tobacco Control Act, especially protecting the general public from environmental tobacco smoke. Advocacy has also been in the reduction of environmental health risks stemming from water and sanitation. This is being addressed through healthier environments and primary prevention programs supported by WHO. In the area of nutrition and food safety, WHO and partners work jointly to improve infant and young child feeding. It produces guidelines for the management of malnutrition and other deficiencies in children. Overall, WHO supports the health sector policy framework, national health policies and plans.
We have always tried our best to make sure that the support that we are providing to the country is tailored to the specific needs.
WHO's involvement in Kenya's health sector spreads far and wide. The world body not only ensures the country implements the resolutions made by the World Health Assembly, but it also provides key technical support for the successful implementation of health programs and services crucial to the well-being of all Kenyans.